I'm sure many doctors haven't heard of things like Theriome before, or even the analysis of these things. But how is it being accepted now that you're putting it out there to the world by the medical community? Because I can imagine you're going directly first off to consumers in a sense, because this is an at-home test. So, you're trying to really convince, at least from a marketing perspective, that the end user should use this and gain some benefit out of it. But for the medical community, when you talk to other doctors, are they excited? Or are they kind of dismissive? Are they skeptical? What are they?
It's not necessarily the medical community that have had pushbacks on. The customers have found it at the lower end of the spectrum, fun and engaging. At the higher end of the spectrum, some really deep insights that they didn't share with me, but we found. They didn't share in their survey data that they returned with their test, but we found nonetheless, biological signatures of those conditions. And so for the consumers, it's been, oh, hey, this was a fun thing. And for others, it's been like, wow, you're a metabolic oracle. For the doctors, they're very excited for this, actually. MDs that I talk to and DOs too, they're incredibly enthusiastic about utilizing this, both as a tool for their practice, and the medical economics of the Aristotle test are quite good, but also because they're driving patient satisfaction. They're driving patient perception of the quality of the care and the competence in their doctors, right? A study from the New England Journal of Medicine found that like 85% of patients want to be offered every medical test possible. And 90% of patients equated the testing they received with the competence of their physician. And so you're boosting patient perception, you're boosting quality of care, because you are giving them the most advanced metabolic test on the market, full stop. And in addition to that, you're decreasing patient conflict. You're engaging the patient to make clinical decisions with you, and that's something that has become, a recent trend. And the most successful physicians I've seen engage their patients in a competent manner to make their own medical decisions alongside the physician. And so this is a tool that has myriad benefits for the physicians, and I haven't received any pushback there. I have received some questions, not necessarily like offensive skepticism, but some questions from the research community as to our particular extraction process for metabolites from the proprietary filter paper, or our methods for the GCMS operation, various parameters like the GC oven ramp, or electron, like the transfer line temperature, various like idiosyncratic things that are important to spectrometrists. Sure. And some of them have been genuinely curious about how we are using our AI method, which is 66 lines of code we've developed, to apply to their own research. So some things, I can't give away. Like I cannot give away the extraction process from the filter paper, but I'm very happy to give away the exact mass spec methods we use, including to the detail of the auxiliary transfer line, the ramp that we set, the amount of helium or the amount of sample we inject, the flow rate of the helium, every single parameter of how the separation and analysis is achieved on the platform is shared, not just with collaborators, but a sort of layperson's version is shared with our customers. And I'm very happy. We do consult with academic institutions to apply our bioinformatics and statistics and AI pipelines and machinery to their projects. We have many academic projects and are in the early stages of preparing our first Theriome papers for publication.
That's exciting.